The main themes of the evaluation report is it targets patients with vague symptoms, quite often where the GP's concern has that gut feeling of a suspicion of a serious underlying diagnosis. And these patients, the important part of these patients is they don't fit in conventional pathways, conventional urgent suspicion of cancer pathways. And if prior to the rapid cancer diagnostic service, these patients would have fairly protracted period of a long investigative path with several investigations to achieve either reassurance or a significant diagnosis. So the rapid cancer diagnostic service picks up these vague symptoms, and we know from the evaluation that Strathclyde's done that gut feeling combined with abnormal blood results and nausea, loss of appetite are the key factors which quite often are associated with a higher risk of a serious cancer diagnosis following referral into the service. So the patients prior to the rapid cancer diagnostic service probably had been referred into other pathways where their symptoms did not fit quite so well. And these are the patients we see frequently referred back into the service, leading to frustration in primary care. And what this service offers is a tailored patient-centred approach, offering rapid diagnostic services for these patients with vague symptoms. We know that from the national assessment, the 5 boards who've been running the rapid cancer diagnostic service in the last 2 years, that we have a pickup rate somewhere between, for all boards, round about 12 to 15% with a cancer diagnosis after referral.
The reason that this all came about in the first place was because it became very evident that patients do present with vague symptoms of cancer in primary care. Around 40% of cancers don't present in a nice, neat way. So it can be very difficult for us as primary care clinicians to know where to refer that patient. And ultimately what was happening was these patients were getting multiple tests or scans or going in and out of clinics or ultimately being admitted to hospital, which is not good for our patients. It's not cost effective. And also is a diagnostic delay to the patient getting an answer to what was wrong with them. So to set up this service has been absolutely game-changing for us because it's very patient-centred. The patient can be seen very quickly. They're navigated through the whole process. And I think GPs find it very satisfying that they can get an answer for their patients quickly.
Met Jackie, the nurse, and she told me the bad news that I had kidney cancer. I had a large tumour on it. Went and met a surgeon with Sarah Reid at Milton's. Very, very nice lady. Told me what she was going to do. She'll get me sorted. Penciled me in for two and a half weeks after that in Milton. Had a kidney removed. When I met her, I spoke to her and I said to her, what kind of therapy am I getting? And she went, immunotherapy. Well, because I came through the rapid cancer diagnostic team, I didn't need any therapy after it. I was caught that early. Kidney's gone, so is a cancer. And I'm happy with that. The care, support that this team are gave me has been fantastic. I thanked him in there when we were speaking, and I thanked him again for saving my life.
I went to see my GP on 1st of February because I felt really unwell. I'd lost weight, feeling really nauseous, really fatigued. My GP said he thought I met the criteria for a pathway that was available to me. So he referred me on. I had a phone call within a day of him referring me, which I missed. Got a phone call beginning of the following week to say that I had a telephone appointment with a nurse specialist. The nurse specialist, I spoke to her on the Thursday. She was very positive about me getting me onto the pathway. And then within a few days, I had an appointment for a CT scan up at here Myers Hospital. I'd had a previous cancer diagnosis, which was treated and I was doing okay about 6 years ago. So they felt that a colonoscopy would be worthwhile doing just to eliminate that the cancer hadn't returned. So I got that done a week later. Thankfully, everything was okay. My cancer hasn't returned. All in all, within a space of 3 weeks of me seeing my GP and getting to this point where I was given an all clear, I think it's fantastic. I think it's a fantastic service.
It's been a collaboration between ourselves and primary care that we don't often get to do. But I think the biggest thing for us as to be able to try and detect cancer earlier, promote positive patient outcomes, and due to the high satisfaction that patients experience by using the service, it just makes everything a bit worthwhile that it's a positive experience that they have gained coming through the NHS Lanarkshire.
An invaluable service to the patients from the first point of contact. They come on, they have problems, you try and resolve them, you get a sense of achievement from that as well, fulfilment. And when they are diagnosed, whatever the outcome, in such a short period of time, job's done.
So I think we need support for the rapid cancer diagnostic services that exist, the 5 boards that have run them as part of the pilot. We need to extend that to the other boards in the country, because I think it's a really important way of working. I think importantly, we need to take the learning we've had from this practice in the way of conducting business to other urgent suspicion of cancer pathways, which allows that patient-centred, focused attention with the active clinical referral triage and the AMP support. And it's all about getting the right patient, right place, right time, and trying to keep that investigative pathway as short as possible to give them either ultimately, hopefully, reassurance or timely diagnosis of a serious underlying condition.